Good evening and happy World Occupational Therapy Day to one and all. With great pleasure, let me welcome every one of you to this webinar, which is organized by the Department of Occupational Therapy of Sri Ramachandra Institute of Higher Education and Research in collaboration with the Tamil Nadu branch of All India Occupational Therapists Association. My name is Rima and I work as a tutor in the Department of Occupational Therapy. I would like to thank the university for giving us this opportunity to conduct a webinar on this special day. For some of us, using GoToWebinar might be a new experience. To ask a question, you can click on the question icon on the toolbar and enter your question in the text field and then press send, and then your questions will be posted and I can read out the question to the presenter, Senthil sir, once discussion is started. So, World Federation of Occupational Therapists, WFOT, is the international voice of occupational therapy profession, which globally comprises of 101 national OT professional organizations. World OT Occupational Therapists Association OT Day is considered as an opportunity to heighten the visibility of our profession's development work and to promote the activities of WFOT in the national and international levels. Without further ado, I welcome our respected guest, Professor Dr. P.V.Vijayaraghavan sir, who is also our Vice-Chancellor, to this webinar. And also let me welcome Dr. Vadivel, who is a lecturer in the Saudi King Abdul Aziz University for Health Sciences. I welcome you, sir, to this webinar. Today's inaugural address will be delivered, and I welcome all the participants who are attending this webinar from various places. I welcome you all. Without you, this webinar will be worthless. So I appreciate your efforts in joining with us today. So today's inaugural address will be delivered by our Honorable Vice-Chancellor, Dr. P.V.Vijayaraghavan sir. Dr. Vijayaraghavan is also the Senior Consultant of Orthopedic Department. He has over 38 years of work experience. Joint replacement and complex trauma is his area of specialty. He has also published a number of scientific articles in national and international journals. He has been a recipient of many prestigious awards and honors. He has played a very crucial role in the development of Occupational Therapy Department in Sri Ramachandra, and he has been our source of support always, and we are extremely grateful for all his contributions. Thank you, sir. And let me welcome you to deliver the inaugural address.
Thank you, Rima, for that nice introduction. Now I see there are nearly 227 participants who have registered for this particular program. Dr. Raghuram, the head of Department of Occupational Therapy at SRIHER. I bring greetings to all the occupational therapists and the students and the resource persons. Dr. Vadivel, who is a faculty member of the King Saud bin Abdul Aziz University of Health Sciences at Saudi Arabia. Thank you very much for being a resource person at this important meeting. I know the time lag is very different in different places. It must be probably around 6 o'clock there when everyone is busy trying to watch the IPL. At Sri Ramachandra, I would just begin by giving some sort of an introduction to many of the participants about our own university. We are almost a 35-year-old organization, which started as a medical college way back in 1985 with about 100 students. Now we have moved on to have 12 different faculties. And right now, the Department of Occupational Therapy is a part of the Faculty of Allied Health Sciences. but I'm sure in 2 years of time, it is likely to become a separate faculty by itself. We also have a faculty of dental sciences, the faculty of nursing, faculty of pharmacy, biomedical sciences, and public health. And we recently have started the faculty of engineering, as is related to biomedical engineering, artificial intelligence, and cybersecurity, and such type of niche branches. We also have a faculty of sports sciences and faculty of clinical research. We are a quality organization who always care for quality 24/7, all 365 days. And this has resulted in accreditation both from national as well as international agencies. We are NAAC accredited with a CGPA of 3.62 upon 4, one of the highest for any healthcare university. We also are accredited for the hospital by both the National Accreditation Board for Hospitals and also by JCI 3 times over. In 2016, actually, when Raghuram actually walked into my room, when at that time I was the Director of Academic Administration, and said, asked actually about my views about occupational therapy, I immediately put my thought process into thinking how this particular education could be taken up by Ramachandra in a very serious way. When I looked at the Google, there were hardly 4 or 5 private institutions which actually ran a program in occupational therapy. Of note was the Manipal University. Then we also had the Christian Medical College, Vellore, and the SRM College of Occupational Therapy, Chennai. So there are far and few colleges which actually ran a bachelor's program or a master's program in occupational therapy. This is not the scenario in the Western world. When I went to US as a Fulbright scholar, I had the occasion to see almost 16, 17 universities. Almost every single university was actually running an occupational therapy program. So to that extent, I felt even in the government sector, they did not have sufficient number of institutions which actually embraced this particular education. So I straight away thought that the government as well as private institutions not having taken up, this is something which will really attract students. And so I put in my thoughts, and we were able to actually begin this program in Ramachandra, the BOT, the Bachelor in Occupational Therapy, in the year 2017. And ever since that time, Raghuram has been a very active person, proactively trying to do whatever is right, getting the appropriate integration from all the specialist areas, and he has been able to put together a program which attracts almost 40 students on a yearly basis. So we are indeed happy that today you are all celebrating the World Occupational Therapy Day, and I congratulate each and every one of you for this particular celebration. Now, it was the 27th of October 2010 which this particular concept was adhered to by the World Federation of Occupational Therapists, and ever since that time, every year this particular day is celebrated. And I'm very happy that today you have brought in an expert speaker in Dr.Senthil Vadivel to address all of you, and I'm sure he's going to open up quite a lot of good discussion on the subject. This year's theme, as I understand, is reimagine doing. See, the occupational therapy is a very important branch in healthcare. A lot of people do not understand this, and they expect the physiotherapists actually to do this job. Any illness, any trauma, any even congenital problem, there are always morbidities and difficulties for a patient. And it is essential that we actually go into depth in order to rehabilitate him, not only from the physical disability, but also from the mental and other social aspects that a person may be suffering from in these disorders. At Sri Ramachandra, we ourselves have a department under the name of Vidya Sudha, which caters to many children in their early days of education who are differently able. Now, this organization probably started almost 14-15 years back, and now we have been able to attract nearly 80 to 100 children who constantly come to this learning center. Now, these are the days of COVID. We all know that COVID has, as a pandemic, has taken the world by surprise, and it has also taken the world to have quite a lot of morbidity and mortality, although India has, to an extent, the numbers are high, but the mortality has been relatively low. We are trying to overcome the pandemic by following some of the basic principles of social distancing, by actually hand washing, and also by wearing masks. But still, the numbers are increasing. Probably Tamil Nadu is on the verge of coming down, and we can say we have probably crossed the peak, but we are worried about reinfection and also about a second peak and things like that. So we really do not know the light at the end of the tunnel, but following COVID, we do find, and this is following my interaction I had with a lot of physicians who have treated this, the after effects of COVID also requires quite a lot of counseling and quite a lot of treatment. Now, from that point of view, it is very relevant that the Occupational Therapy Association, the Tamil Nadu Orthopedic Association branch, have actually put up the theme as Reimagine Doing. We need to think differently and see how best we can help these type of patients in the best possible way. When we look back into the history, we can see that the drastic development of occupational therapy began every time from a crisis. Whenever there is a crisis, we must understand that there is also an opportunity. So this is how I'm sure the occupational therapy department has also taken into the present crisis. The branch as such actually developed following the World War I, when the US military recognized the benefit of reconstruction aids, providing OT services to those dealing with mental health and physical dysfunction challenges after the war. So this was the first beginning of actually trying to provide appropriate tools for people to use some of the disabled parts of the body, and also to help people when they are actually low in terms of their mental health. Here at Sri Ramachandra, we do have a good collaboration for the occupational therapy department with the Department of Orthopedics, of which I am also a part, with the Department of Neurology, with the Department of Psychiatry, with the Department of Pediatrics, and almost all the branches where they can provide help, they have been able to do. We have established occupational therapy clinics in the hospital, and the faculty members of this particular department go and provide the service for many of these patients. So it is a work in progress. Our first set of students who joined in 2017 as this program is a 4-year program, which is followed by a 6 months internship, are actually going through the final stages of the training, and I'm sure all of them will come out successful in the ensuing exams, and this will sort of make them to come back as good occupational therapists. And nowadays it is probably they are the most wanted in terms of the health professionals from various hospitals, including corporate hospitals. Now, so having realized the potential for occupational therapy, there is scope for many of these kids to actually take up a postgraduate program, and we are in the process of actually starting a master's in occupational therapy, and some of them can even pursue extraordinarily good research as PhD candidates. So they have a long innings to go in Ramachandra itself. Otherwise, even as a BOT, when they are attracted towards some hospital, they can be provided appropriate jobs. I am extremely happy that today, under the leadership of Dr. Raghuram, this particular program has been organized, and Rima has brought in the initial inputs in terms of what we are doing. And I am sure with the leadership that Raghuram is showing, not only towards SRIHER, but also to the Tamil Nadu branch of All India Occupational Therapists Association, this particular branch will definitely grow to greater heights in the future. So I am extremely happy to be part of this program, and I consider it a great honor to actually formally inaugurate this particular webinar on, and the present theme that they have kept for this thing is soap notes. Now, in JCI, when we actually went in for the accreditation in 2009, the soap notes was something, a new thing for all of us. That is recording the patient's details in a structured format. What are the subjective symptoms? What are the objective findings? What is the basic assessment? Followed by what exactly is your plan of action? Now, in the past, the medical professionals hardly used to talk to the patients regarding the plan of action. Today, you cannot tell the patient that I will continue to treat without informing you what I am going to do. That is not acceptable. So it is essential that we have a clear plan of action, even for rehab. That's what I told, even for COVID. Many of the hospitals, after they treat the patients, they do give a definite indication of where these patients should approach for their post-COVID rehabilitation. So to that extent, I think the theme of soap notes, on which our expert resource person is also going to throw a lot of light in terms of what we can do. There is something called functional assessment that comes very early when the patient gets admitted to a hospital. Now, this in most of the places was carried out by the physiotherapist, but I personally feel that an interaction between the occupational therapist and the physiotherapist will go a long way in providing adequate care to all our patients. So I welcome all these healthcare professionals under the banner of occupational therapy to be part of the whole healthcare team. And I'm sure with the inputs from everyone and with an integrated approach, we will be able to provide adequate, extraordinarily good care to all our patients. With these words, I have great pleasure in formally inaugurating this particular webinar. Thank you very much.
Thank you for your words of wisdom and that insightful inaugural address, sir. Thank you for joining us today, sir. Our speaker for today is Dr.Senthil Vadivel. It is my pleasure to introduce him to you. Dr. Senthil is currently working as a lecturer in the King Saud bin Abdul Aziz University for Health Sciences, Al Asa, Kingdom of Saudi Arabia. He is pursuing PhD in Biomedical Sciences at Chiang Mai University, Chiang Mai, Thailand. He has over 17 years of experience. He has been and is handling various administrative, academic, and clinical responsibilities. He is actively involved in research and has published articles on national journals. He has also been guiding students in their research works. Sir also presented and participated in various CMEs, webinars, and workshops on national and international level. It is a delight to have you here with us, sir. Now, may I request you to address the participants? Thank you.
Can I start to share the screen?
Yes, sir. You can share your screen.
It is it shows stop screening or
So sharing.
no the
So share your screen.
yeah just
Okay. Yes, sir. We can see it, sir.
now you can able to see.
Yes, sir. We can see it, sir.
That
Can
you
you
can
put
do
it in slideshow?
slideshow.
Yes, Prana?
Sir, can you put it in slideshow so it will be enlarged?
Yeah. It's clear now.
Yes, sir. It is very clear, sir.
Okay. So
Okay,
shall
sir.
I start the session?
Sure, sir. You can go ahead.
Okay. So good evening, one and all. So I really thankful to Ramachandra University senior management, especially head of the department of Ramachandra Occupational Therapy division, and thank you very much, Dr. Professor P.V. Vijayaraghavan sir, Vice-Chancellor of SRIHER. You gave a wonderful introduction and brief about institution and as well whole our profession. So I'm very much thankful to you, sir. So I really wonder to present in your institution to our institution about our professional topic, which is very important for our generation, our professional generation in future. So just thought of give always some other treatment modalities, conditions. So just I was thinking that to give some new approach to encourage the students as well as the young generation about the documentation purpose. So this is the my motto of to select the topic. So today is the my lecture about the SOAP notes writing, specifically for occupational therapist perspective. So we all know about soap. We are regularly using soaps. Soap, without soap, we cannot live in a globally as a person. So we have a lot of soaps. There is a washing soap or body washing and cloth washing. So usually cloth washing, we have to wash the dress properly, clear the dirts, then properly iron, then wear. So the same way, uh, how as a professionals clean in our documentation, how our professional apply our documentation is a in the global. So specifically for we are playing in the human life. So such things we cannot simply leave like a simple documentation or simple manner or like a just hints or nothing like that. So we have to document properly, specifically in Asian regions. In our country, specifically, little lack still, except few institutions. There is a lack of documentation, including government sector and private sector. So we have to standardize in the documentation sector. So that is the main motto of this session. About the introduction of SOAP note writing, is an occupational therapy practitioner is one of the very important rehabilitation profession. Specifically, many different type of people on daily basis we are communicating, we are measuring, or we are giving application to the needs. So they provide instruction for home program to clients and their caregivers. So usually the people has come to as an occupational therapy needs. We are providing too much of home programs and caregivers solutions, so many things, as well as inform other professional on care team about the client's progress in occupational therapy. So when you are following with the multidisciplinary or transdisciplinary peoples, so we are discussing about the what we are doing to the clients, what are the importance of the client. So we used to convey the information about the progressions. So that is a type of documentation that occupational therapist practitioner may use at some point during their careers. So institution wise, the country wise, the specialty wise, there is a different kind of documentation methods. So very recently is the electronical way of documentation is globally popular and familiar to document it than the paper pen based. So the latest one so many institution is doing. So one of the very most common form of documentation is the client progress is called a SOAP note. So SOAP note is the high standard of documentation section, which is used for all healthcare providers. So that is important. So any healthcare providers, we can apply for SOAP note. The writing format is used by many medical disciplines, practice to strengthen the communication among professionals. So example for if you start to document any kind of patient related diagnosis or investigation or intervention basis. So if you start to apply as a one from the beginning, like from administrative section, like start from your entry of your basics. So it will show at end of the medical investigation or intervention level. So everyone can open and see. So that is the accessibility in electronical way. So this is nowadays the so many institution has doing for medical documentation. So this SOAP note have a software structure as well, and the we can use as a paper pencil method. Lawrence Weed is a MD, developed the SOAP note format in the 1960s as a part of problem-oriented medical records. So almost 60 years back itself, it started. So recently it's developed into the electronical way of documentation. So he's the author of SOAP note. Each letter of the word SOAP represent a different component, such as SOAP notes are typically used to report progress in problem-oriented medical records. There is a Robertson 1997 has done a studies, and SOAP is an acronym for the 4 parts of progress notes. There is subjective, objective, assessment, and plan. This is the 4 core point of SOAP note. So obviously, occupational therapists contribute documentation that complies with the structure of the medical records established for their specific work settings. So as an OTs, we have involved all the areas of any kind of specialties. So there is a 4 component about SOAP: subjective, objective, assessment, plan. What is basically subjective? The subjective experience of the client, what the client says. So if a person come to you for the clinical area, so as a patient, what they want to come. So you are asking that. So why you are coming? What is the reason? So that is the way which they gave the information. It's called subjective. Objective, the clinician have to observe it and measure it. That is objective way. So after getting information from the patient, so you have to measure and observe what they need, whether you can some of the patients. So based on the observation itself, you can find it what is the diagnosis or what is the tentative or provisional conditions. So based on that, you have a skill to observe and measure it. After that, you just find it the interpretation based on the observation and measurement. Just identify it. The clinician has interpret the based on your problems or based on your clinical picture or features. So they can interpret in the way of identification of the problem. So then the plan such as description of what will happen next. So what are the next plan? So plan, it's a matter of intervention, if matter of surgical or rehabilitative procedure, or matter of investigation, or matter of standardized tool application. So any kind of thing. So it's a N category to structure the patient treatment modalities, as well as we have to conclude what we are going to do. So this area mostly we lack it. The conclusion we are lack it. So only the people have just observe and do the basic symptoms and do some basic intervention, not the end level process. So this is the plan is very important. So only high level institution, they are doing very properly in the subjective objective assessment plan. So specifically for the plan. What is the occupational therapist have emerged in SOAP note? Is a form of documentation that healthcare providers use. The healthcare workers use SOAP notes to document important information about their patients in an organized way. So we can collect the proper information such as their name, age, inclusion of basic demographic data. The note format help practitioners use clinical reasoning so that they effectively assess, diagnose, and treat their patients. If you get the proper demographic data only, you can measure properly, you can diagnose and treat that properly. And SOAP note also allows you an occupational therapist to defend your treatment choices. So that is very important. So it may plan to find it which treatment is effective or which treatment is appropriate for that particular diagnosis condition. So that is also another one. The simple structure is intended to be clear and concise so that the reader can able to understand it quickly and easily. Occupational therapy SOAP note structure, and that you know what an OT SOAP note is. Let's explore its components. Proper documentation is essential to occupational therapy, but it can often be a tedious process. So if you take assessment or take a observation or measurement, some of the clinicians have think that tedious or lazy or tired in that process, but those who are measuring proper clinical observation and measurements, they have a easy to find it the intervention part and the solution which can be highly benefited for the clients. So that is our motto, to be progress well for the patient. So knowing the basic of how to write a SOAP note should be a priority for occupational therapist in training. So the SOAP note writing cannot become immediately for the junior clinicians or professional freshers. It should be keep on improve yourself to get a well established writing skills. So that is very important. So when you start to improve yourself, automatically you will get be established in manner. So just we'll discuss about what is subjective exactly, what are the examples we are going to apply in clinical side. So just we'll see further. So about subjective, that this document needs to provide as much information as possible about your patients. To do this effectively, think of each section as part of larger narrative. For the subjective segment, you need to preface your patient story by using any feedback that they communicate to you. You can also use any relevant information that you gather from the patient's relative or the multidisciplinary team. This feedback can include how the patient feels and what they hope to achieve through their treatment. Make sure that any information you include serves to explain the patient situation. So the matter of collect a story. So basic introduction. So example, if your patient is approached to you directly, if example directly come to occupational therapist with some reference or some hearings from patient to patient. So you can collect the basic manner. So where are you coming from? How are you? Start a nice rapport to collect the basic information with your conversation itself. That is a subjective skill. The objective, the section of occupational therapy SOAP notes should include anything that you have observed about your patient. Because of this, it will often be the longest portion of your SOAP note. So observation, how the skin color, start from the skin color, start from the structure of the facial structures and the physical You could just think of anatomical way, like upper limb, lower limb, and the spine, and the all the parts of even chest, how the abdomen. So every area, even head also, head you can observe it. So you can observe and how the structure and features will be. There is any standard, or do you found it any abnormal structure in the body or abnormal behaviors? Even you can observe the behavior as well. So this is the way you can observe it. Example for results of manual muscle test, patient level of independence and their range of motion, and other objective measurement related to their diagnosis. After observation, if you find, for example, if you feel that wrist has dropped, or your interphalangeal joints has something flexed position, so there is some kind of deformed position. You might be think that based on the patient complaint that wrist pain, or unable to use the daily occupation. So it might be you can start to test the range of motion, or any kind of muscle test, or else sensory testings. So depends on the patient complaint. So that is the measurement. You can use goniometer measurements, or manual muscle testings, or filament, monofilament testing. So anything you can choose it. As an expertise therapist, if you find the patient compliant itself, you can think of that which area of assessment can do it. So that is your skill. And about recorded all of the necessary information, you can move on to the next section of your soap note. So whichever measurement you've done related to the patient compliant, you have to note it down. Next, you can analyze it, that is assessment. So assess your patient situation by synthesize. It's the second level of analysis. Subject and objective information you gathered so far. Use this analysis to summarize your clinical reasoning and discuss how all of the information will. Got it? Somebody's nothing. So some sound has come, Rima, Miss Rima. Nothing.
Sir, it is muted, sir.
Muted. Okay. Then it's okay. Then I'll continue. Okay. So this analysis to summarize your clinical reasoning and discuss how all of the information is related. You should also use your analysis to talk about your care will help the patient achieve their treatment goals. Don't be afraid to showcase your knowledge and experience with this paragraph. You put in countless hours to complete your coursework and become the occupational therapist. So now it's time to put all of the effort to use it. So the thing is, clinical reason out, and you just synthesize the based on the measurement. You just identify where the lack is exactly compared to the normal and the abnormal cases. So you just find out the problem. So based on that, analyze it. Then only easy to plan for that. So that is setting of the goal, and which one can be, which intervention or which approaches or which treatment modalities or which assistive devices or any kind of frames of reference is applicable for that particular problem. So once you have outlined your analysis, it's time to talk about what needs to be done. Once you find it a problem, example for lack of range of motion or limited range of motion or lack of muscle part, or there is a lack of response and sensation. So that you just find it what you can do. So which approach can be applicable for that one, specifically whether it's a biomechanical approach or related to any kind of PNF techniques or roots approaches. So which one can be applicable for that particular issues. This section you must think ahead when it comes to a care plan and how this plan may change throughout the course of your treatment. A few examples what you should write or any updates to your treatment plan, additional assessment, future check-ins, and recommended discharge dates. So based on the treatment plan, we just start to fix a treatment plan, how long it will be, how many sessions, and how it follow-ups, how many days once follow-up, whether 1 week or after 10 session or 12 session. So depends on the condition and depends on the institution, depends on your policies and regulation. That's why all the hospital there is a policies, right? So policies and the procedures depends on the department wise. Even overall hospital there is a policies and procedure. It's under the quality matter. But particular department there is a vision, mission, policy, procedures there is a department wise or specialty wise, they have a condition wise, there is a policies. So that is very deeper assessments. So that's why NABH and the JCCI has approved, VC has said that JCA and NABH, there's approved based on this kind of documentation how the standard will be, and also recommended discharge dates, how long it will be. As we said before, the final statement should be concise without omitting the crucial details. Learning the art of occupational therapy soap note take time. Luckily, there are plenty of other resources that you can use to learn about soap notes. So we have a lot of resources to learn how to write it, lot of models, lot of cases, lot of textbooks, lot of websites there to learn it. So that is a very important one. You can get feedback from your colleagues or even look up examples online. Just remember that it's important to keep practice and learning from any mistake that you make it. Even you can check it yourself with your colleagues, your superiors and your peers and your just seniors, anyone you can learn it. And so this is the learning matter. So you can start to write and document it and learning with your team members. What to write in soap notes? So what we discussed is, what is that? What is occupational therapies? Write it. So here, what to write, how to write it. So in the matter of paper, pen or typing to the electronic, that's up to us. So what I said, write in this section anything that someone says to your reports. This can be the patient, relative or a member. This can be face to face or on the phone. So subjective, so depends on you. So nowadays face to face or the phone. So nowadays mostly telehealth or telemedicine or telehealth rehabilitation mottos is following this pandemic period. So many patients are so following this about telehealth consultations. You can note it down about the patient data and details, what it is in earlier stages. The type of stuff goes in this section includes consent to the treatment, about the type of stuff that goes into this section includes consent to treatment, social history from patient or family member, how the patient says they are feeling, client goals and wishes on discharges. So these are the matter you can record it. There is some examples of subjective, how patient reports they are feeling, how they pain and fatigue, voice, etc. So you can collect the information based on the patient conversation or patient oral informations. The main part of the initial interview is the social history. See the post. So we used to, as an OTs, we used to have a habit of taking histories in detail, like a family history, educational history, occupational history, medical history, surgical history. So many things we are used to collect the information and even have a behavior of student level itself. So that would have a habit of document properly. That is important. So improving our initial interviews for a full description of what information you require for a full social history, who they live with or if they live alone, type of property, house, flat, where you are used. So that might be relate to your plan. House, flat, if it is example patient have wheelchair, if there is any obstacles, so how to resolve on that. So that is also one reason to collect information about where you are living, what it is, how the house setup were there, whether they rent or own the property. If it is rented, who do they rent it off? There is a private landlord, house association, council. So this is also important to collect this basic information about, so find out the house status and the economical status and social status as well. Do they live in a sheltered accommodation? You can collect whether they sheltered in. Do they have any adaptive equipment at home? So usually the old age peoples, geriatric patients used to have some of assistive devices for walking or in the accessibility because of aged process. They have some generalized fatigue, generalized weakness is there. So how it will be? So how they adapt with the equipment? Do they have a false alarm? any symptoms they faced. Otherwise, used with any aid or indoors or outdoors. So they have a crutches or tri sticks or unipolar sticks, or so whatever it is, depends on the patient need. Do they transfer independently on off chair, bed, toilet? So some of the old age people's need difficulty in transferring. So that's why we study transfer techniques, how to transfer from bed to chair, bed to wheelchair, wheelchair to bed, and moving from one place to another place, how it will be. That is also you can collect the history. This is related to us specifically. For this is old age or else some kind of chronic disabilities, physical disabilities. Do they have stairs? How many rails? Any difficulty with them? That is also so mobility skills, right? So you can so subjective assessment itself, you almost cover all the main matters. And also someone help them with, or can they do independently washing, dressing, meals, cleaning, housework, laundry, and shopping. This ADL matter. This also you can collect the subjective. So based on your conversation itself, you can collect maximum informations. So so based on this, you can find it whether ADL dependent or independent or mild or moderate or severe, whatever it is. You just find out it. Do they wear pads? Do they usually get up during the night to go the floor? So you can take a different way. There is any behavior pattern, or there is any poor bladder and bowel dysfunction, you might be note it down. During the assessment, did they ask you to help them with something that is requested for you to help them in the bathroom? So bathroom also one of the area. How the bathroom, there is a bathroom, so many components, right? So sitting on the bathtub, sorry, sitting on the bowel, or washing and the spraying of the water, that time how the hand grips will be, how the posture will be, everything. So how the help, there is need mild support or moderate or no need or independent, how it is. So it depends on that, you almost cover the major components. During the assessment, if you have spoken to relative to validate the social history, write that they have said or any concern comments voiced by family members. Ask the nursing staff how much assistant person required getting washed. So mostly inpatient cases, you can collect information from your colleagues or multidisciplinary team members. About objective, what you have observed. So during observation, during your ward rounds or visiting to your OPD, or when you go to their home house visits, so just check about the observations. So some of the therapists, some of the home care therapist is there because the patient is unable to come, some of their personal reasons. So that also you have to assess it. So this anything that you have seen. The objective section, write your observation, results of standardized and non-standardized assessments, range of movements, initiation of task, distance of mobilization, assistance level, and equipment required. These are the areas you can measure it. About the example, so a very exact example for where they are on arrival to the ward. There is bed on arrival, sit out on the chair, any attachments like a catheter, nasal sepsis. So mostly we can see in the adult cases, spinal cord injury, stroke, any neurological conditions. You can visible the patient have an initial stage has a catheter and nasal specs on drainages, some Riles tubes under tracheostomy they done. So you can check it how it will be. Then mobility gait and how many people did it need for them to mobilize safely, and with the mobility aids, maximum assistance or gutter frame or supervision or Zimmer frame. These are the examples of that. How distance walk, how many rest breaks that they had to take it. Did you have to walk with a chair behind them? So how they can take rest on that. Transfers, how chair, bed, toilet, how much assistance required, any rails or equipment used. They transfer from a hospital bed. As the backs rest up, did they grab onto side rails? So this is very specific area. So you are measuring the very specific area in detail about the transfers, how the transfers. So wheelchair, so in that how the posture will be, how the seating position will be, how the your postal alignment will be. So everything you have to check it on that. So that is very specific one. That is postal assessment. And wheelchair measurement, anything you can take depends on the patient setup. You may want to note any chair, bed, toilet heights, or any range of movement or muscle part test. So Oxford scale or range of motion test that you may have done with a physio, or things like timed up and go test or Bathel index as well. Appearance and or cognition. So we have to check confused, agitated, shouting out. So depends on the patient. You can take under specific measurement. In that specific measurement, you can take as you patient reliable information which you found it. After that, you can assess it. So talking into account what you have heard and what you see, what you make of it all, summarize your clinical reasoning by writing the conclusion that you have reached from the subjective and objective and how they are affecting the client occupational function. So that is the important. So occupational function, so which are child occupational function, play or feeding, ideal, so how it is, even learning skills, it is also occupation. Adult, how the activities of daily living, how they are interest, hobbies, roles, rest, occupational participation, occupational performance, occupational context, how it will be. So that is, you will find out it which area the patient has a lack. For example, that fear of falling and sacral pain is restricting movement, or that the patient mobilize easily with a gutter frame, therefore progress to a wheel Zimmer frame. So this is the one of the example about the patient feel sacral pain. It might be have a restrictive range of motion. And also analysis part in this first interview together with the physical therapist depends on how you do it at your workplace. You may decide what aid and how much assistance the patient requires. At this moment, the nursing staff know how to mobilize the patient. So after, if you have to ask it, maybe the depends on the patient medications or intervention. So how they are mobilized before you measurement or analyzing. After that, you can find out the problems, then you can mobilize. Depends on the assessment findings. Are they back to their pre-admission baseline? How far they off baseline? Remember, you don't have to get patient back to baseline before you can discharge them. It is about making sure that they can manage at the home itself. So it is you have to analyze and make it to baseline. What to until discharge, you have to plan it. What to do for that. It's a good to make an assessment on how different they are to their usual presentation. Can they go home if they are medically fit for discharge? Do they need further assessments? There is a kitchen assessment or washing and dressing assessment. If it is needed, if you can assess how they can well manage with their activities, the occupation. So kitchen assessment or washing, dressing, ADL assessment, none other than that. So you can measure specifically and you find out it where is the lack, and you can make them to train, and then you can discharge. That is the planning area. That is goal setting. Do they require equipment for home? Is this essential for discharge? Will they need further rehabilitation? That we can set on that. So you have to decide on rehabilitation. What should their goals be? The goals are usually things like this. So mobilize with walking aids, transfer independently on different structures and independent with chairs. Rehab goals are usually around mobility, transfer making, and writing rehab goals that people don't need to be independent with washing, dressing, meals, etc. And also anyone today, anything like physical therapist work on mobility of requests. So it's a teamwork which we can be assess and find out the problem and can be analyze it, identify the problem where it is exact before planning or setting of the goal. About the plan, as a result of your analysis, what needs to be done, that is intervention area. And with a statement justifying the continued need for occupational therapy input if required. In the plan, I write any updated goals, whether short-term goals or very near short-term goals or the long-term goals, or anything else, updated goals, modification of therapy and subsequent treatment sessions. So usually the study, this is a study. So usually for we'll try some approaches for few sessions. If it is improved well, it is based on your evidence-based practice. That will come to the evidence-based practice. So if you had the same condition, previous patient has did this kind of techniques, this kind of approaches, this has improved, the symptoms has rectified. So you can apply same for that particular session. You can try it. If some cases have a rare chance of it, research says some cases rare chances is not applicable for all patients for same technique, you can change the different approaches or different frames of references. So anyway, we are, as an occupational therapist, we are not going to do any surgical or any oral medication, just application of external approaches which related to the motor, cognition, or perceptual enhancement skills. So that can be applied and trial it. So whether it's improved, if it is improved, then well and good, we can continue for that. So check about the example: environmental assessment to review the patient in 2 weeks or planned discharge date. So environmental assessment, some patient does not cooperate that particular environment, they don't like also, even specifically for adult, mainly geriatric patients, some of mental health patients, they did not adapt that particular environment. They might be want to the different, so they have a particular environment, they shows different features. That particular environment, they shows different features, mainly related to mental health aspects. They shows different angle. And also some of the obstacles, right, architectural barriers, which we know about that. So what barriers might be there, so they don't like in that particular environment to live, so they make change accordingly. That's why we can usually we do the home modification assessment. So some of the example about include types of things that would write in a plan: further mobility, transfer practice, progress onto wheel Zimmer frame, assess with a piece of equipment, referral to rehab or other services, anyone you need to anything. So you can refer nearby places, or if it is accessible near to your clinics or hospital, you just plan accordingly to visit frequently or according to your follow-up dates as well. STAR assessment, functional assessment, cognitive assessment, order equipment. That is further advanced assessment. You can take it, depends on the need, even home visit needed. Secondary intervention, mood and pain, any changes, that is related to recreation, some of the aspect, and the ADL assessment, ADL things. So primary, there is a secondary. So which is important one? So which is the secondary one? So important acute case, acute area, you can solve it. Then later on work on the well progressed level into the chronic areas. So some of the best guidelines for better notes, these are the best guidelines. Deploy a template. So you can deploy the template very well. So you have to take a template very perfectly. You can frame a template. You can, even every institution have a different kind of assessments. So based on the SOAP notes, so make it too short and like establish some specific templates, depends on the condition. Some well developed institutions such as some old institution in our South India, like CMC and KMCH, SRM, some of Manipal. These are the institutions which I know well about. They have a separate templates for individual conditions apart from the common assessments. So that could be a well established detailed assessment that should be noted very perfectly to find out the problem and can easy to identify the perfect intervention area. Adopt action words. So there is action words there. So no need to write very longer word. So you can short it out. There is relevant details and establish the SMART goals. This SMART goal is a some of the standard way of measurement: specific, measurable, attainable, relevant, and time bounded. How to measure it. And don't rely on copy pasted. Some of the cases mostly won't happen. So few peoples they do for the copy paste method, like a copy from previous to other one. It is okay, but legally it's not good for that. So not encourage on that. So make sure notes are legible. So handwriting. So some of the persons writing illegibly and unable to read. There is a two things. If one thing is the person has unable to write properly, that is their own problem. But there is another problem, laziness. So just simply written under. So better for the legible way, even short and sweet way. So that is the better guidelines for better notes. So this is way we can write notes. So should be a perfect documentation. So these are the common abbreviation. I can share my PDF or my PowerPoint to the organizing committee, they may distribute you. So there are a lot of abbreviations there. So we can use in our SOAP notes for subjective or objectives. So no need to waste the time. So that's why use action words is better. So a lot of abbreviations is there. So we can use ADL. We are very familiar to ADL. Like that, so many. AD means assistive devices, ADD adduction. So we have to just memorize, keep practicing it, so we can learn it. So a lot of it's related to, there is so many, just I put on the slide only related to occupational therapy. So about so many things which we can deliver about in SOAP notes. So these are the short-term abbreviations. Okay. So this is the forms which we can use institution based. So there is a institutions, there is a printed forms, backside of the assessment, there is abbreviation. If it is until proper practice, you have to copy it. Example for AAROM means active assistive range of motion. So like that, ABD means abduction. So some of the institution, they can have a proper printed form in backside of the assessment or backside of the documentation file. You just check it and you just note it down. So it's a practice period. Later on, you can automatically you will practice it, so you can write your own style with the short forms. There is a form which is used for MUSC Health, Medical University of Southern California Health. So this is the assessment, occupational therapy progress notes. Specifically, they are using this way. See rolling, TA, maximum, moderate, minimum. See the short forms, which is it. So same way, TA means see total assistant. Max means maximum assistance. Moderate means moderate assistance. MN minimum assistance. S means supervision. And M means modified independence. MI. I means independent. So they already coded. You can just tick it how the patient depends on your assessment. You just do the tick mark and save the time, and later on that you just summarize, you just set a plan, assessment analysis, then you can do the intervention. So this is the way you can do it. So we can, every institution or even small clinics or small rehab centers, even individual practices, private sector, anywhere you can set a form like easy to identification. That document should be very strengthened. That is also so many Indian scenario is it okay, but even India also nowadays progressed in all the areas, documentation, academical area, qualification wise, everything. So in future, maybe if you're even if you do for the private practice, the people if you like affiliation or if recognition like MCI, Medical Council of India, is affiliated some institution or NABH, maybe in occupational therapy clinics, our occupational therapy own practice persons have a standard way of documentation to get proper identification, identity to others. It's a role model. Take as a role model for that. So make everyone have to plan it according to the SOAP notes. It should be useful for all practitioners. So this is what do's and don'ts of writing occupational therapy documentations, what you can do, what you cannot do for that. So that is also important. Do use this subjective part of note to open your story. When each note should tell a story about your patient and your subject portion, these are the things you can do it. So as we know it, open note, feedback forms, patient states excited about that, frustrated, he still can't do it. So we can encourage these kind of things. Sit back this first week, we can, because so we can hear the positive encouragement. So negative, we just stop it. That is don'ts. Don'ts, let's admit it, where to storytellers. So they are telling some of the patient very detailed information and unwanted thing. They showing like their own self-pricing, proud their self, and they're telling different things. And they are telling about so many treatments they done from the different centers, different hospitals, and they does not realize the what is the reason you are coming here. So they're telling about that self-pricing. So it's matter of avoiding on that, then overboard with unnecessary details. So no need to go in detail about the personal things. If a patient is seated in chair on arrival, patient let me into her home. Patient requested that nursing clean his room. So this is the nuisance things which we have deal in clinical practice. People does know very well, and also the language also important. Some of the languages people does not give a proper respect. They shows that they know everything. So these things you have to avoid it, and no need to collect unnecessary details on that. And also objective way. So if a student level, usually the faculties has instructed when you go for the clinical posting, bring the inch tape or goniometer assessment or stethoscope or like this one tendon hammers, even some of the small notebook with the pencil, or nowadays notepads or mobile phones apps they can use for the assessment as well. So these are the things can be assessment. So this to be the clinical reasoning expertise. So everything it's related to that points. And on whole the assessment section, don't skim on the assessment section. So hold it. The assessment section is your place, it's time, or your education and experience to really drive this one paragraph. We tend to just write patient tolerated therapy well, or we copy and paste a generic sentence like this patient can do. So just avoid on that copy paste from this previous to other things. And the lack of resource aside that not enough represent all the education you have it. So just copying from previous one, it's just avoid on that. Just on hold the section, and don't think that later you can fill it up. Just do the hints and do it. Make a hints, and you just maybe when you have a free time you just elaborate it. So this is the way we are lacking. Even some of the countries like Singapore, even Japan, uh, some of the hectic places there to work, even documentation, they don't have a time to fill it all the proper doc because they have a structured documentation. Even Qatar also, one of my friend discussed about the documentation. They don't have time to complete the assessment. They have a separate time for that. 15 minutes, 20 minutes per patient per day. Exactly when you enter into that particular time to when you leave, that particular 40 minutes or 50 minutes, what you are doing. Step by step, you have to note it. So in some of the therapists said, in Singapore, they are writing documentation in midnight, 12 o'clock also to send their bosses in midnight, because they don't have time in that to complete the document. So if you that way, if you document properly, that is legally perfect. Even the medical insurance you can claim. So that every this kind of insurance and the legal aspect. So people has expect specifically for documentation what you are doing, what you are what every day you are doing what session. So that's very specifically. Even I heard that some of the insurance company hire the physical therapist and occupational therapist to scrutinize the documentation whether it is needed or not needed. So that way we must know, we must need the very specific documentation. So planning is very usually don't get lazy on that. Even continuous education courses, note writing and geared towards physical therapist or OT. So mostly lazy on that to write it, spend talking about how important, but better to avoid it. That nowadays so many institution has computerized. So computerized, and you have to enter everything in the computer. When your patient enter inside and left outside, so that particular session, whether assessment or whether intervention, you have to enter properly, like log in and log out. That kind of manner has arisen now in globally major institution and major countries. So even if you think that lazy, you cannot. But if you are a proprietor or if you are a owner of that your institution or your clinic or your practice, that's maybe up to your own policy. But if you're a worker of other institution, you have to uh, rely on that, and you have to depend their policies and procedures. And the strategic plans of patient care, it should be rocket science, you don't have to write a novel, but you do need so that you are thinking ahead and considering how your patient care plans will change as they progress through treatment. And also continue working with, consider something like working with the patient on toileting, gradually decreasing verbal and tactile cues, which will enable patient to become more confident and independent. Stability exercises to home exercise program to stabilize patient right upper extremity in the new range. Decreased OT frequency from 3 weeks or 2 weeks as tolerated. Short, sweet, and meaningful. So you can make it a short, sweet goals. Some of the good institution, they given the proper home program schedules, making daily how you can make it to do, what are the instructions, what are the things you have to do in the house. So make a short and sweet plan for that. So one of the example I added in this lecture about the outpatient occupational therapy evaluation. See the name, medical record number, date of birth, evaluation, diagnosis, treatment diagnosis, referring. So this is finished, just small paragraph. And about the subjective. So how the subjective and objective assessment and plan of the care. So just I will share this note. You just check it how it will be. How the short way of writing in the subjective and the objective way and the assessment. So this is the related to patient example. That example, it should be useful for your practice. And also major benefit of using soap notes. What is the benefit? It is a structure. They can quickly log on to their computer or medical tablet, access patient records, and scroll down to the plan section where that information would be highlighted. So the main benefit to be patient records. Patient record is important. So that which I already told, that electronically as database and documented in the computer or medical tablet as well. So they have apps, they have websites, login, logout ID. You can check it and you can upload your subjective, objective plans, assessments, everything. You just upload it. So that is the main way of the access the patient record. Example, if you do the assessment, if you do the therapy or intervention, just you are visiting the therapist in that particular one session. So they will give you the website or they will give you the apps or login, logout IDs. You can open in your house and you can check it. And also very important, so many Western countries, even non-professional parents, patients, they have a good knowledge in documentation as well. If you not document well, they can ask a question. Even they have to print out and ask you questions. How many sessions? Why you are given these 2 sessions only? I want this much session. I want this much therapy. So many questions they will ask. So you should have a very clear and legible writing on your plan and the assessment and the analysis and your subjective objective. So that is clear, concise, and much less likely to result in miscommunication between healthcare providers. So nowadays, don't think that patients and patient caregivers and even children with pediatric. So mostly the mothers and will come with the sessions. So they are very clever. You cannot miscommunicate them, and you cannot give fake interpretations or fake informations. They have a more clever ideas. Even nowadays, as you all know, 5G has arisen. So many social medias there, so many easy accessible in the in-deep village level. So everyone have a good knowledge in the subjects, not a subject, in the informations. So everyone have a rights to ask a question, not a matter of just practice. So you should have to be very conscious about that, and means you can follow the proper documentation process. So some of the researchers also said positive way of approach, which is essential and which is important for a clinical practice. This is the studies which I mentioned, latest studies. Just check it from this. Generating soap notes from doctor-patient conversation, May 2020. And there is a second one, soap notes, Vivek Porter and Valer Sison Gassam Zara. Is a Tarunisa Memorial Medical College and Hospital. There is authors. They have given the soap notes in the positive way of writing, how it is beneficial. And also other research study towards an automated soap notes classifying utterances from medical conversation, Benjamin Scholes, and there is a USA study that is also positive way. So how the soap notes will be effective in the documentation, how it was useful in this. So these are the common things about soap notes, and some of the my level best I gave some of the occupational therapy documentation informations about that. It might be useful for that. So I'll give some of the very specific examples apart from soap notes, which we are clinically use that can implement. That is a different lecture, different things. Just I'll give the basic about that. Pediatric occupational therapy goal on a more practical level. Which one you can use it? So based on this, you can use it. So apart from, there is a standardized tools and non-standardized tools specifically for occupational therapists. So this is for the documentation purpose. Before going to the standardized level, advanced level in the planning area, you just make it like this, simplify your assessment. So it might be better for the clients as well as yours. The SMART goal method is used to set goals for people in many different industries, from marketing strategists to occupational therapists. It is a well-known framework and provides us with high-level guidance by encouraging an emphasis on time-bound measurable goals. There is a SMART goals, it's called a SMART goals. There is a specifically what are you doing to do, why are you going to do it, and how will it be accomplished. So that is, so these are the questions which will ask your patient or get the information, you can measure, write it. That is a specific, very specific matter. Example for autistics. So very specific. So you can ask what you are going to do, why you are going to do. So the patient, you find it that they have auditory defensiveness or tactile defensiveness. That is what are you going to do, why are you going to do. So what are you going to do? The patient has a tactile defensiveness. Why are you going to do? Because of tactile defensiveness, I found it's exactly tactile defensiveness, so I'm going to do for that. How will it be accomplished? How it is established? So what are the areas? So measurable, you can measure this perfectly, and you can put the goals, whether it's a short or long, when will you know it been achieved it. So I'm going to do this particular application sensory integration technique, which is solved for the tactile defensiveness. I will give some kind of textures to apply to solve the tactile defensiveness, to give the Wilberger protocols for so just example, just apply for that particular days and particular week, it might be solved, or it might be goal based, goal success. Attainability, is this goal something that can be achieved by your patient, but some work is too easy or difficult? So how it is attained? So maybe you can check after that, after a few sessions, you might be work on that, you might be get easy or difficult way, which is the patient related to goals. So it's whether it's attained or not attained. And relevance, does this goal target useful skills or behavior? So you want to be diminish the tactile defensiveness. So how it will be target? So what are the, whether the child behavior changed, the child walking on the sensitization is differs from that previous stimulation to the present stimulation, how the goal of your target has achieved based on your measurement and attainability. On what time frame will be this goal be achieved? So you have to be mention the goals, how long it will be, how many sessions you can give it, all those things. So that is depends on one example. Fusion LLP, SLP, Sarah Getman, MSCC LLP has, this is the a language pathologist, they has derived these goals, but we can use it also to make goal writing easier with SMART goals. However, in recent years, goal frameworks that are more specific to occupational therapy have emerged. This offers goal setting methods that are better tailored to the OTs as well. And another one which we can look into, that Willard and Spackman textbook about 11th edition of Willard and Spackman occupational therapy. It's particularly helpful for making sure the goals you are setting for 4 patients are helpful to both you and the family. For your patients, making sure you are setting understandable and measurable goals. About RAMBA. So RAMBA is the easy terminology which we can memorize. It's a relevant. What function is this goal aiming to achieve? So understandable. Will the child and their parents understand this goal? So you have to explain what purpose. If you are giving to the swing, different kind of swing, how the postal gravity has stabilized, how the postal control is improved, how the proximal stability has control, how the proximal stability muscles has improved. So that is understandable. So which activity which you are giving, you have to explain what is the purpose. So parents should understand and make them sad. That is the very big challenging in private practice as well as the even all the practice clinicians. So whichever activity which you are giving to the patient, you have to convince the patient, and also that should be scientific way. That is understand the goals which is giving to the patient, that should be explained in properly. That is understandable. Measurable. How will you measure this goal? So that is the we are using to do the pre-test, post-test measures. So many standard and non standardized tools there, pre-test measures and post-test measures. How it would be effectful or not effective. So that we can use it. And behavioral, what behavior occurrence will the goal address it? How the behavior, like your changes of your behavior and attitude, which during your goal attainment. Achievable. Can you reasonably expect your patient to achieve this goal within the stated time? Of course, we have to work on that. So we have to achieve, our target is to achieve that particular goal, particular problem solving strategies. So which is work on that. If it is possibly is working on that. If it is not, we can try the different techniques. Depends on the practice experience, on your policies matter. So that is another goal, another area modalities which is applied for goal writing was introduced. Gately and Brocharding's text documentation manual for occupational therapy. That occupational therapy framework is great for ensuring that you are addressing a specific occupation with your goals and establishing specific timelines for goal achievement. Client post, client will perform. Occupation, what occupation does this goal target? Assist level, with what level of assistance or independence will the goal be achieved? And specific condition and what diagnosis depends on your problems, what it is, and timeline then will be the goal be achieved. So these are the some of the related to documentation methods which is specifically used for occupational therapists. So we can practice based on this, depends on the practice and clinical areas. We can try to implement one condition, like group peoples or together joined and implement it, so it might be easily perfect as well as easily learned, and our profession will be very standard based on your documentation. If you saw the documents are very perfect, so everyone is happily recognize our profession as well. That is also good view that standardized our profession. So this is end of the presentation. These are the some textbooks you can see in PDF forms or in your Amazons, and some of the institution there is a library is available. These are the textbooks there, some of the forms, models there. You can take it and practice your document, depends on your practice area. So this is almost over. Thank you very much. Thank you all. Any questions, please ask me.
Thank you so much, sir. There are 3 questions, sir. Can I read it?
Yeah.
Okay. The first question is, how does the subjective and objective component of assessment vary for psychotic patients? Do we follow any other criteria?
Psychiatric patients is little different. Usually depends on the practice. As I frequently said that psychiatric the patient wise is differs. Mostly psychiatric patients, it's little confidential matter which is subjectively collect mostly in the caregivers. So subjective assessments. So you cannot get all the information from the patient itself. So psychiatric patients, you collect from information from the attenders. If it is neurotic cases, you can collect, but psychotic cases, most of the information you can collect from the caregivers, attenders, all those things. Even subjective matter you cannot take initially complete evaluation for. That is, you may take a MMSE mini mental status examination initially, but it takes it after settle down with the medications, it takes 1 or 2 days to mainly for rapport and interaction, and confident development is very important for psychiatric patient. The therapist and patient have a good means good interaction and good confident level. You have to create a good confident level, then only they will explore slowly. Mainly for depressive patient, if example for suicide attempt patient, they have some personal issues, so they want to explore. They have a lack of socialization, they have a lack of appetite, sleep, and hopelessness, worthlessness, helplessness. They cannot explore their personal views. So once you be bond, you have a better bonding with the patient, then only they will explore. Until that, you will get the information from the patient attender or caregivers or parents. You got it? Is it okay?
Okay, sir. The next question is, can soap notes be applicable? Can soap notes be used for follow-up cases? Like after the initial assessment,
yeah,
when they are coming
of
for.
course. Yeah, we can use it follow-up cases. It's also easy, the time saving, the matter of soap notes, which you can use the follow-up cases. Same assessment you can use, but it should be shorter, because you already knows the patient, there is a history. So you just there is a follow-up cases. If you found any new complications or new problems, or if you want to add up some extra programs which is before this is compared to previous sessions, then you can add up that. So follow-up also you can use it. That's better way of documentation. Even some of the hospitals, they can hold your documents until around 10 years too. Even very established hospitals, they don't have a space to manage it, because every day they are seeing more than 2,000 3,000 patients. Even recently one hospital has gave advertisement, we are going to fire almost until 2010 level patients. So the matter of review and follow up is holding with high standards, but it should be soap notes. We can make it a short, that's it, but we can use it.
Okay, thank you, sir. Another question is, the case example you showed us had hand dominance, etc. after the subjective note. My question is, if we write it there, what do we write under assessment? Like for a patient who requires a detailed hand function assessment.
Okay, detailed hand function assessment, when you will decide is once you planned. First, the patient come for some hand problems generally. So example, if the patient have a hand injury, they have a crush injuries, they have some amputated fingers, they will come to you after hand surgeon. They will come to you for splints or some assistive devices to encourage the hand functions, or basic hand function, range of motion or muscle power, you may use it. But when you come to that, you just finding it perfectly, which is important. Example, if you want to do the you find it, the patient have a crush injury, the nerve has injured, so the patient is affected more on sensation, you have to choose the sensory assessment very specifically later on, that after your plan, that will come into your plan. So planning means standard, so very cognitively more affected, motor more affected, perceptually, social, emotional, ADL, which part is more affected. If you found it, then you can choose any standardized tool, then you can use. Example, for hand, you can take later on Jepsen hand function test or ERHAD hand function test, you can use it. So standardized tests should be very specific in later stages. Once you find it, mostly in the analysis stages. If you set the goals, So if you're more on that particular fine motor area, you just choose any related to that particular assessment.
Okay, I think that's the end of the question, sir. Okay. So, sir, what is the ideal way of managing the patient load and the documentation writing?
Ideal way. So that's depend on the institution, but basically my perspective, if it is if you want to be a higher standard documentation, is my perspective. So I can share my views, then you that's decide or depends on the institution. Ideal way should be if you want a higher standard, if example as your VC means explained about, you have developed all the departments, you can talk about the pediatrics. So pediatric, you have to frame separate document, pediatric assessment, CP separate, LD separate, ADHD separate, autism separate. Then you have to be a subjective objective assessment plan. Then under that you have to mention what are the standardized tool can use that particular cases, specifically for ADHD, specifically for LD, specifically for autistic or CP. Even the neurological cases, I know this is the high standard. It's a very tough job, even TDS also. You have a not time to focus on that, but there is a separate team. If you work on that, you have a high quality care, and your department will be highly it's like a quality wise you are a high standard. So that is the which I feel this is the high standard way. Even electronically you can try also that, create apps or create some websites to measure it. You can already fix it, but no need to handwritten. Just type yes or no, or poor, fair, or tick, or no, or independent, or just tick. I show you one model assessment, right? MUHS, Medical University of California, I think Southern California, MUSC. So you can use like that. You can make it to frame, but we have to work hard on that. Once you work hard and you are achieved and your database is clear, you are uploaded every documents, then every patient has come, you just tick 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 and do. Your junior has followed, and follow up also very easy. This is my perspective, my view. But every institution has created. That's why NABH and JCCI and so many in Arab nationals there is also some accreditation units. They expect separate vision, mission, policies, procedures. So you have a committee, make a committee, and you have to set a goal. You can work on that. If you work on 1 year, your department will be highly standardized and easy accessible, and everyone is perfect, legally good. Maybe covering insurance is good. Nowadays government also enhance the autistic schemes to give the, so documented well. Even in Tamil Nadu culture, if a matter of language, might be create both language, English and Tamil as well as like. So this is the ideal way of standard. The SOAP notes is matter is standardization of the documents. That's it. That's the SOAP notes based on your knowledge. Are you okay? Or?
Yes, sir. Thank you, sir. So I think we can have feedback from any of our students.
Hello, ma'am. Hello, sir. This is Shalini. Am I audible?
Yes, you are audible.
Good evening, sir. This is Shalini. I'm a final year OT student. Thank you for this elaborate presentation on SOAP notes. I think that forms the base for, the ultimate base for documentation in occupational therapy. And thank you for being so detailed about it. And I never know that people have also been there doing researches on the effectiveness of using SOAP notes, and I think that's the most preliminary thing that we do, right? So, and it also covers almost like the important aspects that we are supposed to consider in an assessment. This was a unique topic, of course, and I thank my department for choosing such a topic and representing you to present this topic, sir. Thank you very much.
Thank you so much.
Thank you, Shalini, for sharing your feedback. I think it's time for us to wind up the session. Before that, I would like to thank the administration of Sri Ramachandra and Tamil Nadu branch of IOTA for giving us the opportunity to organize this webinar on World Occupational Therapy Day. I extend my gratitude to Dr.P.V.Vijayaraghavan sir for delivering the inaugural address. I extend my thanks to our guest speaker, Dr.Senthil Vadivel sir, for accepting our invitation and also providing us with so much knowledge and information regarding SOAP notes from an OT perspective. And you, in your presentation, you had pointed out a few mistakes that we all do. So that was very enlightening for me and also for other my fellow occupational. I believe it is for other fellow occupational therapists. And thank you for letting us know the importance of documentation. Even we know that it is important. Sometimes we fall back on writing notes regularly. So it was also a motivating session from you, sir. So I thank I thank you for your patience also, sir. So I thank all the participants who are attending this webinar from various places. Thank you for your cooperation and responses. A special thanks to our HOD, Raghu sir, and Assistant Professor Sundar sir for Sundareshan sir for coordinating and organizing this webinar for us. I would also like to thank the IT team of Sri Ramachandra for their support. Last but not the least, my thanks to the faculty and dear students of Sri Ramachandra. Let me conclude this webinar by quoting Ms. Dr. Marilyn Pattison, who is the president of WFOT. Help others to understand the vital role occupational therapists play in what makes population healthy. We need to strive to take our rightful place as agents of social change and equity. So thank you, and let us all reimagine doing. Thank you.
Thank you, madam. Am I audible?
Yes, sir.
Okay. Sorry for not able to join at the right time. Anyway, I think participants also felt very bad for waiting almost 10 minutes. Really, I feel proud to have our respected Vice-Chancellor for giving a wonderful speech in the aspect of inaugural address. And also, I'm very happy to have more than 200 participants. So apart from that, I have a very good respect in the occupational therapy field on Dr.Senthil Vadivel sir. He is very senior, and everyone knows that in Tamil Nadu he is one of the very important person. He has a very good vision on what to have a high standards of practice. That's why he has chosen this topic. Really, what I feel very happy that the participants, whoever may be, whether the students or the graduates, I think everyone get benefited from this session. And also, I would like to thank our department, especially Rima madam, Sundaresan sir, and other faculties, and also my students. So apart from that, the management, and I used to say that always Vice Chancellor is very support. Once again, I would like to thank our guest speaker, Dr.Senthil Vadivel sir, who did about excellent session. Though I'm not able to join at right time, I'm able to hear this inaugural address and the presentation, everything. But finally, I got the chance to speak at the end of this session. Thank you so much, sir, for providing an excellent session. Thank you all.